So, ladies and gentlemen, as we come to our final keynote, and we're heading here from highlight to highlight, let me tell you, we turn to someone who is currently on the ICT&health cover, who is on that cover because he has not only witnessed global health history, he has helped shape it. He's a physician and an epidemiologist who worked with the World Health Organization during one of humanity's greatest public health achievements, the eradication of smallpox. He later became the first executive director of Google.org, exploring how technology and resources can be truly put to use for global good. Beyond this incredible list of achievements, he's known for his humility, his optimism, and his deep belief in collective action, something I think we need now more than ever. A close friend of Steve Jobs, someone who's seen the world in moments of crisis, of deep crisis, but also in moments of idealism and transformation. He continues to work today with the same curiosity and humanity, most recently as the CEO and co-founder of Evity AI. Ladies and gentlemen, please welcome to this stage, Larry Brilliant.
Thank you so much.
Enjoy.
Thank you, Sunny. And everybody should give Sunny a big applause if we're at the end of the day. She has graciously led us from topic to topic. I also want to thank Lucian and Tom, who's probably hidden someplace out here, for bringing me here. It's really a pleasure, and I have had the honor of getting to meet some of the most amazing people in the world here. Thank you for inviting me. I want to address some comments to Esther, if I may. How many people in the room here think that nurses are heroes? How many think that nurses are professionals? So about 6 weeks ago, President Donald Trump and Secretary Kennedy removed the designation of professionals from nurses. In doing so, nurses who are students are no longer able to access loans in order to finance their education. That'll certainly help us to bring in more people into nursing, won't it? The consequences that we make in venerating our heroes and in telling their stories and understanding how important they are, it must spill into policy making or it's not real. And I want to thank you for your presentation and for humanizing the work that nurses do. My first day after medical school, I was thrust into we used to call it a coronary care unit. And technology was just finding its way in. And if it weren't for nurses, all the people in that unit would have died because the physicians didn't even know how to manage the system at all. So I have a great belief and a great fondness for my experience there. So I'm the last speaker today. I wish I had done this in a little different order because I should end with an inspiring story. But I'm going to begin with an inspiring story. And then I'm going to talk about a frightening story today. And then I hope I'm going to give you a little hope for the future. First, the inspiring story. Smallpox might have been the worst, most dangerous disease in human history. It may have been one of the 10 plagues in Egypt in the Old Testament. It may have been the disease that afflicted Job. We know that smallpox viruses have been retrieved from the mummies of Pharaoh Ramses IV and V. That's how old this disease is. We also know that in the 20th century, which I remind everybody who's young, that was 27 years ago, In the 20th century, smallpox killed somewhere between 300 million and half a billion people. They were mostly children. They were mostly children under the age of 5. When I first got to India and worked in the smallpox program, I was 27. Hundreds of thousands of children were dying of smallpox every month while I was there. It's a fearsome disease. I'm going to show you a couple of dirty pictures, but they're not that kind of dirty picture. I'm going to show you some faces of people who had smallpox. I don't do it for purulence or to get your sympathy. I do it because we've eradicated that disease. And I want you to see how bad it was so you could celebrate the international cooperation that led to its conquest. So the first case of that young boy, that was actually made into what we called a recognition card. Over 2 billion photos of that child named Muhammad Ami, who was a young boy in Pakistan, and a CDC epidemiologist happened to be there and photographed every day of his disease. We took that photo, and if Asa is here, that was the single most viewed photo in the world until NASA's photo of the moon. And we gave it to people all over the world, and we would go house to house and said, have you seen anybody that looks like this? Because the smallpox eradication program changed from being a mass vaccination program to being a search and protect program. We had to find every single virus of smallpox everywhere in the world at the same time and draw a ring of immunity around it. That was something that was innovated by Bill Fagey. Bill was a missionary doctor in Nigeria during the Igbo Civil War. He had very, very little smallpox vaccine. A horrific outbreak began where he was, and he had to decide how to allocate the vaccine. And normally in a circumstance like that, the Minister of Health from the Igbo community, Minister of Health from the Nigerian community would come forward and say, vaccinate my brother, my cousin, my sister, my wife. Bill thought that the morally best thing that he could do was to protect the person most likely to get smallpox next, and in doing so, interrupt the transmission. So he began going house to house, vaccinating the people who were most closely linked to people who had the disease on their face. And in doing so, smallpox disappeared. That had never happened before. Now it's commonplace. We call it ring vaccination. Bill Fagey invented that, and he died 3 days ago. And again, the poignancy of Bill passing away, as he would say it, in his 90th year, he was 89, on the same day that the United States flag was pulled down from the front of the World Health Organization. That poignancy should sit with you. Because without every nation's cooperation and Bill's innovation, we wouldn't have been able to eradicate smallpox. You need both. You need innovation and you need cooperation. The woman in the picture has a kind of smallpox called hemorrhagic smallpox. It was 100% fatal. And it had a particularly cruel propensity to infect pregnant women. I don't say that lightly. I'm sorry about that. It doesn't exist anymore. We got rid of it. It was on my fuck it list. It's gone. And we really wanted to fuck that. So this terrible disease, it was eradicated by 150,000 people, doctors from 200 countries, every race, every religion, every color, every language you could imagine. Our meetings were just amazing. And the international cooperation was keynoted by Russians and Americans, Soviets and Americans, who buried the nuclear hatchet, so to speak, and worked together in teams. My best friends became Russian epidemiologists. I want you to think about that today. And you would say, well, that can't be done today because it's such a terrible time, such an acrimonious time. I want you to know it was worse then. For young people who think this is the worst it's ever been, no. In the Cold War, the Soviet Union had 23,000 nuclear-armed missiles pointed at American cities We had 29,000 nuclear missiles pointed at Moscow. We had 4 or 5 broken arrows. How many of you know what a broken arrow is? We've got some people from the security world. A broken arrow is when you launch a missile with a nuclear weapon towards your enemy, in this case, and you lose control of it. Of course, if it lands, it'll start thermonuclear war. You've lost control of it, and sometimes you have to pick up the red phone and call people who are your enemy and ask them to shoot it down for you. Tensions were so high then that the idea of us speaking to Russians or Russians speaking to Americans were unthinkable. It was harder then. It's hard today, too. But we can do this, and the whole point of putting this first is to tell you how it can be done and how important it is that we now deal with another pandemic. To do this, we made 2 billion house calls, and we assembled the largest United Nations Army peacetime ever put together. It was an amazing experience. And earlier, Lucian interviewed me for a podcast, and he said, "Can you think of any really big obstacle that you ever faced?" Well, that was the big obstacle. But worse than the actual act of eradicating smallpox was that I was working for WHO. I was the youngest person on the team by 30 years in some cases. And the head of communicable diseases for all of WHO thought we were all crazy and wanted to pull the plug on the program. Thought we'd never do it. Because smallpox was not considered in many parts of the world a disease. It was considered a condition. In India, it had a name like Bashanto, which means spring sickness, Mariama, one of the goddesses, or Shitalama, the cooling mother. In Nigeria, in Japan, all throughout the world, smallpox was venerated as a visitation sometimes. And in England, Lord Macaulay wrote many times, smallpox is not a disease. It is a condition as inevitable as the sun and the night sky. And one person who was the head of communicable diseases in WHO thought that we should be pulled out of the program, that we should all be fired, that it was a fool's mission, that it was a waste of money. However, we did eradicate smallpox. Long story. I've written books about it if you're interested. But the most important thing is that it happened. And this little girl, Rahima Banu, in Bola Island in Bangladesh, was the last person on Earth to have variola major, the dangerous kind of smallpox, that killed 1 out of 3, and she didn't die. And this balloon is a balloon that I bought 4 years before that in Berkeley, the United States, and I carried it around for 4 years, hoping and praying that I would get to see the last case of smallpox. And I took this picture when I visited her. And when the scabs fell off her face, and they landed on the ground, and they were cooked in the heat of the Bengali sun, that was the end of an unbroken chain of transmission that had never been broken all the way back to the pharaohs. And of course, when I stood in front of her, I did what any one of you would have done. I cried like a baby to think that that had happened, that I had been able to participate in that. And I vowed then to continue trying to do things like that again. And all of us who worked in that program made a similar vow because we got back so much more than we gave. We got back an incalculable gift to be able to see that done. But it couldn't have been done without global cooperation. And the other day when we were in the hall in which the euro was created, by cooperation among European nations, I was reminded about how critical that is in this moment. These are very difficult times. Those were worse. We were able to do this. We're very close to eradicating polio. We're this close. We've been this close for about 5 years. So far, it's cost about $20 billion. But we can get there. And think of the suffering, the human suffering that is alleviated by that. I hope that we will be able to have international cooperation like that. Now, it doesn't look like it, does it, when the U.S. pulls down our flag in front of WHO. But we will again, We will get through this, and we will do great things. And all of you will have an opportunity in your lifetime to join things like this. And when they come by, grab them and jump for them. Do not put them on your bucket list. Put them on the other list, because they will transform you much more than you will transform it. So this is the certificate that we wrote on how you can guarantee that smallpox has been eradicated. There's another certificate that's signed by all the health ministers of the world who, looking at the proof that we gave them, agreed that we had eradicated smallpox. I should tell you about that Dr. Ignatovich, that head of communicable diseases at CDC. He was so angry with what we were doing and thought it was so stupid that he made a public pledge that if ever we were able to eradicate smallpox, he would eat the tire from a Land Rover. And, you know, I was young and foolish. One of the best days of my life was when we took that tire, we put it in a crate, we put it on the top of a Toyota, we drove it to what was then Palam Airport, now Indira Gandhi Airport, and we sent it to Dr. Ignatovich in Geneva. And my boss, Nicole Grasset, a French-Swiss virologist, she wrote him a very elegant letter. Dear Dr. Ignatovich, we have eradicated smallpox. We accepted your offer. Now it's your turn. Here's the tire. Would you kindly let us know the bouquet, the flavor, the tenderness? And should you desire any condiments, just telex us. So I hope that inspires you about human beings. You know, you might be a little disheartened right now by our behavior, but we will get past it, and we will together do great things again. Now, we have another pandemic we have to deal with. It's not the same kind of pandemic. When you think of COVID, you think of smallpox, you think you know what a pandemic looks like. You think of 1918, that's one kind of pandemic. We have another pandemic, and that's the pandemic of sick-span. What is sick-span? So we know what lifespan is. You've heard often enough here now that you know what health span is. There's a period in between healthy longevity, health span, and lifespan. And that's called the lifespan health span gap. That's what actuarials call it. We should call it by its true name, sick span. It's the period of time we all spend sick. And now, worldwide, it's about 14 years. In the United States, it's 15 years. The US ranks 34th among the 38 OECD countries. We spend the most time in our life in sickness of all the developed countries except for 4. I want you to know that spending 15 years of your life in sickness is not normal. It doesn't have to be like that. But is there anybody here that hasn't witnessed an uncle, a parent, a grandparent in decline, frail, with Alzheimer's or cancer, being treated for cancer, with heart disease, in that bed, in that hospital? That 15-year period is not normal. It's not the way it used to be, and it need not be in the future. And it's comprised of about 15 things. As an epidemiologist, I look at it and I say, well, this % of those diseases could be prevented from metabolic diseases like diabetes, obesity, cardiovascular diseases like heart failure, neurodegenerative diseases like Alzheimer's. Most of all, musculoskeletal diseases, because that's one of the major causes of putting people in the hospital in wheelchairs. So I unpack that, and then I say individually, which of these diseases and conditions can be prevented or delayed? I mean, I don't mind getting Alzheimer's if it happens the day after I die. We can prevent these diseases. And the best estimates are 50 to 70% of the years of sick span are preventable. 50 to 70% of the years of sick span are preventable. What a huge burden of suffering that would be lifted off from our shoulders if we could do that. And economically, sick span is eating the health systems alive. You know, in the US, we spent last year $5.7 trillion on healthcare. $4 trillion of that was spent during these 15 years. If you could reduce sick span by 50, 70%, well, that money could go to other things. It could go to help nurses. It could go to help patients in their need. We could repurpose it. But to do it, we would have to invest in prevention. Not always so easy. As people live longer, since 1900, lifespan has doubled from 40 to about 80. But we're living less healthy lives. We need to address it as a global emergency. If you look at this, the effect that we will see now in the United States from increasing years of sick span, on top of that, the new legislation in the United States, hospitals are under such pressure because of this 15 years. US hospitals operate on a 1% margin on average. 35% of US hospitals do not have enough cash to make their budget 6 weeks from now. The effect of recent legislation reduces 8% from the operating budget of hospitals. If you have +1 minus 8, I don't know about you, how good you are at math, but it's not good. American Hospital Association thinks that 2,000 hospitals of the 6,000 will go bankrupt. That would mean 1,500 emergency rooms would close. What will happen to the people who are so sick that otherwise they'd be in hospitals that don't exist anymore? And I'm sorry, Europe is not immune. This is not just an American problem. This is a human problem. The EU spends less than we do in the United States, but it is 10% of GDP. And in the UK, it's thought that 70% of that money is preventable. In the EU, the differentiation between poor countries and rich is so profound that you could find Malta, Italy, Sweden. You can look at Japan, which is not in the EU. You can look at most of Northern Europe, and you can find that it is life expectancy over 80, healthy years of life around 70. But if you look at Latvia, Bulgaria, Slovakia, you can see that the sick span, which is the difference between the 75 and the 52, is 13, 14, 15 years, as much as the United States. We must close this gap. We must compress morbidity. We must introduce prevention in order to do it. And this burgeoning epidemic of sick span is stealing our health and it's taking away the money to invest in our children's health. It's an enduring problem that we have to solve. And we can't just solve it with $50,000 new drugs at the end of life that extend your cognitive processes by 3 to 4 months. I mean, I know how desperate we all want this. We're all going to want it if we're in that position. But as a community, that's not the way to get out of this. Daniel just gave a brilliant talk yesterday. He really opened us up. Was it today? My God, I can't believe that. Well, maybe yesterday he was brilliant too. I think he was. In fact, you can borrow my name if you want. But he shows us what a potential future would be. We can't get to the future that he envisions unless we solve this problem. There won't be money for it. There won't be the energy for it. So we need to solve this problem. So what's the hope for the future? We need a global movement. Not one company, not one university, not one country. We need a global movement like we had for smallpox. We need to look at this as a global emergency. We need to find people to work together. We need to create memes that get us all excited. And I'll give you the meme that I want. It doesn't sound as romantic as, zero smallpox, which was an organizing principle. But the meme that I want is to increase health span on average by 1 year worldwide. Now, that doesn't sound like much, but it's probably worth $100 trillion to the global economy. Increasing health span by 1 year in the United States, McKinsey estimates, is worth $38 trillion over a decade. Now, that sounds crazy, doesn't it? But that number is actually accurate, and when you unpack it, it makes sense. Increasing health span by 1 year is also equitable. Why is it equitable? Because where are you going to get those years? You're not going to get it from a town called Ross, which is 2 miles from my house, where life expectancy at birth is 92. You're going to get it from the poorest and most vulnerable. And my friend Paul Farmer, I hope you know who he was and what he did with his life. But he always said you have to have a preferential option for the poor. The name of my company, Evity, was chosen because the word Evity sounds like equity. It also rhymes with longevity. And my friends who know me when I'm not talking about such serious things say it rhymes with levity, because I think that's critical, and we talked about having fun. Sometimes it's difficult talking about smallpox to have fun, but you can do it. It's just a little harder. I think we can put together a global coalition of universities, of companies, of hospitals, healthcare systems. Even I think we can get payers to get involved. Payers are not necessarily our enemies. Some people may think so. Payers are just malaligned. The incentives are malaligned. Why would you invest in prevention if you're in Silicon Valley and everybody swaps their job every 2 years and they swap their insurance company? You invest in the prevention that aids the person who's going to be providing that extra income to a different health system. Here in the Netherlands, you are a single-payer system. It may not feel like it because there's 5 different insurance companies, but ultimately they're all paid by the government. A single-payer system, as most of Europe has, as the NHS in the UK is, allows us to reap the benefits of money that are spent early on prevention, because later on in life you won't have this 15-year period. So we want to introduce population-based science to find preventive measures to reduce the period of time that people spend in sick span. My rallying cry is if we just increase health span or reduce sick span by 1 year, we will have done something amazing for the world, and I'd like to be part of that. That is an accomplishment as good as smallpox eradication. I say that because smallpox eradication increased longevity in the planet Earth for human beings by 3 to 5 years. Life expectancy increased 3 to 5 years just by eradicating smallpox. Let's add 1 year by reducing the burden of sick span. And I think Europe is poised to be a leader because your incentives are not as malaligned as elsewhere. In fact, coming here, I can't tell you what a joy it is for my son and I to come here, because we now have a Netherlands company. We actually finished incorporating a BV about 2 weeks ago. So you'll see more of us, I hope. We'll see more of you, I hope, because this is an audience that understands what I'm talking about. I could talk about this to an insurance company in the United States. They would understand it, but they couldn't participate because the incentives are so poorly aligned. And these are some of the reasons that I think that Europe will lead this movement. You understand the value of data, research, and AI. You have the guardrails on AI that we will need to have. When you say that AI should not be regulated, you're an idiot. Of course it has to be regulated. And we have to understand it. The idea of letting AI free to get everybody's patient records and then make it owned by one company, which is one of the conversations in the United States, that doesn't benefit us. But AI will help us in tremendous ways. It will transform our life. It could make being a doctor or a nurse more human by giving us more time to be more human. And I'm an optimist. I think that is the way it will go. But we have to be very careful about its use. And you also lean in on value-based care. You lean in on longevity science. You know how important it is to have a measurable return on investment. So what we're doing with Evity is we're starting right now, sorry about that. I've been talking too much today. But that's okay, you get rid of me in a couple of minutes. We're doing a trial with a large AI company with some very large health systems. We have 10,000 patients with their genome. We're matching them against 1 million patients in longitudinal databases. And we're looking disease by disease, condition by condition, patient by patient, to find non-obvious correlations, things that then can be packaged and put together in individual health plans for everyone in that trial. And I'm going to tell you about one example of that. So we're starting with a fictional woman named Ruth Wellstone. She's homozygous for the two genes that are the worst genes to predict whether you get Alzheimer's or not, ApoE4. And when you're a homozygous, you mean you get one of these genes from your mother and one from your father. 3.4% of the world is homozygous for ApoE4. If you have one gene, 25% of us, every fourth person, look around, 1 out of 4 of us have one of these genes. If you have one of these genes, you're 3 to 4 times more likely than normal to get Alzheimer's. If you have 2, you're 75% likely to get Alzheimer's. In our study, we expect to get 340 people like Ruth who are homozygous. We expect to get 2,500 that are heterozygous. And in the million population that we're matching, we're going to get a lot more. So we use an agentified matching engine. We take all of the electronic health records from the patients. We put them in a machine-readable package. We go hunting in these large longitudinal databases for matches. And then we look for a way to do clinical trials in silico. They're not as good as an FDA clinical trial, but they're pretty good, and they're getting better and better. And if 75% of people who are homozygous for ApoE4 are destined to get Alzheimer's, the epidemiologist in me asked the question, what about the 25% who don't get Alzheimer's? What are they doing differently? So we have the advantage of looking at 20 or 30 years of their lived experience to find out why those people escape Alzheimer's. And we have a fancy name for it in epidemiology. We call it a retrospective prospective match pair analysis in silico. I like saying that. It makes me feel like a scientist. But we can do that to the 10,000 patients. We can do hundreds of simultaneous match pair analyses for each patient at the same time. Millions and millions of people can go through this process simultaneously. That's the great value of AI. AI can handle things at scale that no human being could ever handle. And AI sees things that we don't see. Now, this is what I'm very proud of, by the way, that we are in the Netherlands. I hope that you don't mind. We're really happy to be here. I want to finish one thought, and I'm almost on time, which is really quite amazing to me. If we can do this, and we can do it not just for Alzheimer's, but for heart disease, metabolic diseases. How many of osteoarthritis? Be honest. We'll all close our eyes. I'll look only. There are 5 genes that will predict 95% of your risk for osteoarthritis. Who knew? Now the question is, what will prevent it? If you look at Alzheimer's, we are learning that there are many things that were not obvious to us before. If you take a Shingrix vaccine, that reduces your risk of Alzheimer's by 20 or 30%. Now, the first time you hear that, that's a WTF moment. It looks like if you take lithium, or if you live in an area that has high lithium content in your water, that reduces your risk of Alzheimer's by 20 to 30%. GLP drugs, plus minus, could be 20%, could be nothing. Statin could be 20% reduction in Alzheimer's. I can make a list. I can add on exercise. I can add on a loving community, purpose-driven life, better diet, better sleep. All those things together add up to be about 3,000% of Alzheimer's that will be prevented. There's something wrong with that, isn't there? I'm just guessing, you know. So what is it? What is it? Which of those really matter? And which of those are inexpensive? And which of those are easy to democratize? And which of those are easy for a pharma company to look in and say, I'm going to bundle this and this and this, I'm going to put a name on it, And then I'm going to actually take it to an expensive clinical trial so that doctors feel comfortable using it. That's the way this stuff works. Large data, epidemiology, population science, brought down to the level of each individual patient. Maybe it sounds like science fiction. We can do this today, and we're starting. And we hope that this will be the beginning of a movement. Actually, that's not true. The movement already exists. We hope that you'll let us join it. Thank you very much.
Larry, brilliant. Thank you so much
Thank you so much.
for all of this inspiration and for giving us and leaving us with hope. I'd like to still have a quick moment with you. Yes, please.
You know, I've been interrogated by some really terrible people in my life. You are not one of those.
Well, that's wonderful. I haven't even started. So, you know, you've shared some of the things, recent developments that are worrying you with the U.S. leaving the WTO. And then you've shared... WHO, excuse me.
WHO is probably next on his list.
But yes, probably it is. Excuse me. And then you've shared some moments that have given you incredible hope that stem very much from your personal experience living through this incredible moment of global health success. If you look out today and you would be at GIN 27 and you would be starting out your career, what would be something that you would tell your 27-year-old self to keep hope before, because later on you would know it, why, and this is what I think drives you in so many ways, to be so convinced. And I want to figure out, what do I tell the 27-year-old that hasn't yet made that experience, but has all the energy to do so?
Have faith, be resolute, even stubborn. If you know that what you're doing will help others, you're on the right path. In fact, Mahatma Gandhi was asked a question like that once. And a young man came to him and said, they called him Babaji. He said, Babaji, how can I know that I'm doing the right thing with my life? And he said, come back tomorrow and I'll give you a magical amulet. And the next day the boy came back and he went to see Gandhi and he put out his hand and Gandhi said, it's not that kind of an amulet. But it will protect you nonetheless from ever doing wrong and always doing good. The magical amulet is this. When you consider the next act that you're going to do, ask yourself to visualize the poorest, the most vulnerable person you've ever met in your life. And then ask again, will the act that I am contemplating benefit that person? If it will, you're protected from doing anything wrong. And if it won't, you should think again. And I heard that while I was in India, and it always made so much sense to me. Those of us in health are being given a gift. We have some control or measure over the lives and health of other people. It's a great responsibility. It's also a great joy. In response and in recompense for giving us that responsibility, we should think like Gandhi thought, or as I say, Paul Farmer thought. I think it will protect us from making those mistakes. And all of us, by the way, waver. I mean, I fail that test, 300-400 times a day. But be resolute and come back to it over and over again. Ask yourself if the act that you are contemplating will benefit the poorest, the most vulnerable person that you've ever met. I think that's a pretty good magical amulet.
Great advice. We've spent a lot of time talking about technology this morning, and then we've spent a lot of time talking about humanity this afternoon. And I'd like to close with trying to bring these two together, because I think that is very much what also Evity, what you're trying to do with Evity. Where do you see the biggest gap between what technology can do and what we right now choose to do with technology?
I think it's in our training. I was lucky enough to go to university on a scholarship, and because it was funded by the American Actuarial Society, the only requirement for me was that I had to take classes in actuarial science, population science. And I always carried that idea through. After smallpox was eradicated, my wife and I started an organization called the SEVA Foundation to work on blindness, and we've given back sight to 10 million blind people in 25 countries now.
That's
and
amazing.
we did it by having rock and roll concerts, benefits, and raised $500 million.
That's incredible. Can we get an applause for that?
But when I started working on blindness, we decided that we would pick the worst, hardest country in the world to work in, which was Nepal, because it was so remote. We had a phenomenal statistician, Leslie Kish, draw a random sample of villages in Nepal, and we realized that a third of them were in the mountains, inaccessible. It's a long story, but we got a helicopter donated to us for 6 months. The Grateful Dead did a benefit concert to fly that helicopter in a package inside of a Flying Tiger into Nepal for us. We had to reassemble it there. You ever try getting a helicopter permit in Kathmandu? It's really difficult.
Yes,
And then I had that helicopter for 6 months. And at the end of 6 months, on the last day of the survey, the helicopter crashed. It didn't crash in a bad way. It crashed, as they say, like an oak leaf falling in fall. It looked like this. And everybody was okay, but I had to get a new engine to replace it. My friend Steve Jobs had given me an Apple II number 12, a Corvus hard drive, 5 megs. Larry, you'll never need any more memory in your entire life than 5 meg. And a Hayes modem, 300 baud. Yes. How many of you remember that sound? So I was able to catch a new satellite, the Landsat satellite, and bounce a signal off of it to the University of Michigan and to Stanford, and link them together with the manufacturer of the helicopter, the renter of the helicopter. And I should say lots of ambassadors and senators and things like that. And we were able to have a new engine donated, flown in, taken to the place in Bharatnagar where it had crashed, and the helicopter flew out under its own power in 72 hours, which in the United Nations is impossible to do anything. And Steve Jobs was visiting me. He got an honorary doctorate at Michigan, and he was staying at our house, and I showed him the system that I had built. And if I can borrow your fuck it word for just a second. And I showed it to him, and I asked him to donate more money to the SEVA Foundation. And he looked at what I had built with this, I barely built anything before. I was still writing COBOL, I was writing Fortran then. And he said, Larry, I'm not going to give you any more money for SEVA. He gave me the money to start SEVA. I'm not going to give you any more money for SEVA. What you've just shown me is a product. Take your own fucking product, make your own fucking company, make your own fucking money, fund your own fucking charity, and I'll help you. And he did. He helped me take my first company public. And that led me into technology. And ever since then, I've run technology companies. I've been privileged to work for Google, Salesforce, Apple. I mean, my training in medicine and technology is so fortunate for me. What we're missing in order to deliver on the promise that Daniel has brought us year after year again, because he can see the future. He can see the future better than anybody I know. He can see the future around corners. But we're missing people who are cross-trained in engineering, data science, epidemiology, medicine, because the conversation is complicated. And your universities are making people like this today. Send them to us. We want to hire them. But more importantly, we want your universities to produce more people who can, if not create AIs, be smart consumers of AIs. If not produce medical care, be smart consumers of them. And such people used to be thought of as unicorns, but there are more and more now. And if my 27-year-old self knew that, I probably would have done exactly what I did.
Well, thank you so, so much. I think we could all just continue sitting, listening to you.
Thank you.
And it's such an honor to be able to spend these moments with you. So thank you very, very much. Larry, brilliant, ladies and gentlemen. Please, yes. I'm speechless for a short moment. I'm supposed to summarize this day now, and I feel like it's been so incredibly rich. That's the word that comes to mind. How wonderful it is that we got to experience a day like this together. It's so rich because we started out with talking about the importance of togetherness from our Ministry of Sports, Welfare and Health. And then we continued with trying to understand what's now, what's near, and what's next. And really seeing how the superconvergence that has been shared on stages in Maastricht back in 2010 and 11 has accelerated in ways that I think are hard for us to truly grasp, and yet it's so important to stay close to these developments. And I thank Daniel Kraft for making this so digestible in spite of the lightning speed at which we were moving through the slides and towards the future. And then, obviously, you have all had so many opportunities to learn from one another, to go deeper into topics that are relevant for your context, in your current moment in which you stand in your professional career, and in your segment of the healthcare sector. And so there's so many learnings there, which I think each one of you carries, that I have no idea about, but I'm so glad they happened. And I hope they'll continue to happen. And then we came back here this afternoon and learned about die Heldin, the hero, the Shiro, if you so will, in many cases, who's working tirelessly, as we are here and every day, to make care human. This idea of patient centricity, this idea of, yes, the future is happening and there's so many technological developments, but let's ask, what do we actually need to make a patient healthier, to improve a patient's life? And let's start with that question. And how to do that here in the south of the Netherlands and beyond. So many great examples, so thank you for that. And last but not least, this talk just before, which gives us so much hope and reminds us of what the indomitable human spirit can do when everyone unites towards one shared goal and idea. I now need to transition to the logistics. And it's a hard transition. There's no way to make it beautiful, but there are a few things I do need to mention at this closing moment of the conference. First of all, tomorrow morning, doors will open at 8 a.m., and we will see each other here at 9:15 sharp. Some mentioned to me that they thought it would start at 9:30. It starts at 9:15 sharp, and we will make sure you also get a push notification through the app. We're also trying to summarize not just here on stage as I did, but we're trying to summarize everything that's happened on day one. It is a first experiment, so it's a soft promise, not a hard promise. But tonight, this evening, you should be receiving an email with an attempt of a summary. And now, for this last moment, I encourage you, you are in Maastricht. Many of you are visiting from other continents, from other countries, or from other regions of the Netherlands. Enjoy the city, explore it, continue the conversations, and challenge each other to think beyond what is today and into the future, what could be tomorrow. Ladies and gentlemen, it's been a pleasure. I look forward to seeing you tomorrow morning. Thank you so much for a wonderful first day, and enjoy your evening.